For as long as ADD and ADHD have been prevalent and well-known disabilities, there have been myths created about them. Many of these myths are never looked into and in return are believed to be true. We have brainstormed and come up with 3 popular myths and the actual facts behind them. Myths and Facts of ADD and ADHD by Aubrey, Flora, and Elizabeth. ADHD that is first diagnosed in the preschool years tends to be chronic and severe, but each child's course of illness is different. Here are some myths. Preschoolers are too young to have ADHD. It is quite risky to administer ADHD medications to preschool-age children. Girls have lower and less severe ADHD than boys.
In response to these myths, there are facts that prove them to be false. The first fact states that research shows that medication in this age group with moderate to severe ADHD shows significant signs of improvement. The American Academy of Pediatrics in 2012 stated that they recommend treating students first with behavior therapy, but that if it is not effective within 9 months, they should be treated with stimulant medication if the students are 4 to 5 years old with significant ADHD.
The second fact states girls are just as likely to develop ADHD as boys. Girls are just less likely to be diagnosed. Girls have a greater intellectual impairment, but are not as hyperactive as boys with ADHD. They also have mood and anxiety disorders and have a lower IQ. Girls also have problems in social, school, and family functioning. Girls have higher levels of stress and depression than boys with ADHD. Girls may report more distress than boys, and they may be more affected by environmental factors than males with ADHD themselves.
The last fact states that many children with ADHD do not show significant impairments until they begin elementary school. There are some preschoolers who manifest serious and sometimes dangerous behavior problems between the ages of 3 to 6 years. Doctors sometimes have a hard time diagnosing ADHD in preschoolers because they cannot decide whether it is normal behavior or ADHD behavior because of how young the children are.
We hope you have learned a little more about what are actual facts of ADD and ADHD and what are only myths. Keep in mind to not believe everything you hear because it could not be true. Thanks for watching.